Hello everyone. Today we are going to be learning about the topic anti-adrenergic drugs and solve the RS questions that are related to this. But before we start that, we need to know about some basics, that is about the sympathetic nervous system. In sympathetic nervous system, we have sympathetic receptors, and all these receptors are GPCR. GPCR means G protein coupled receptors. So all the receptors of sympathetic nervous system are GPCR, G protein coupled receptors. We have two types of receptors in sympathetic receptors. We have alpha receptors and you have beta receptors. Further, alpha receptors are of two types, alpha 1 and alpha 2 receptor. Beta receptors are of three types, beta 1, beta 2 and beta 3. Alpha 1 is of GQ type, alpha 2 is of GI type, and all the beta receptors are of GS type. Now what do you mean by these? GI type means it is inhibitory type. It is an inhibitory type of receptors, and these two are excitatory type of receptors. The difference in these two lies between the mechanism of action, like how it causes excitation. This receptor GI type always causes inhibition. Further, alpha 1 are of two types, alpha 1A and alpha 1B. Now we will be looking into where these receptors are present and how do they act on stimulation. So alpha 1A is present on two sides. It is present in the iris and it is present in internal urethral sphincter. You can remember I, and from 1 you can remember I. So iris, it is usually present in eye, and what it does, it causes active mydriasis. Mydriasis means dilation of the pupil. So it causes active mydriasis. Internal urethral sphincter, what does it do? It helps in contraction of the sphincter. Now if there is contraction of this sphincter, what will happen? There will be urinary retention taking place. Contraction of sphincter. Moving on, in alpha 1B. Alpha 1B, from B you can remember it is present in blood vessels. B say B, right? It is present in blood vessels, and what does it do? It helps in vasoconstriction. It increases the BV. Why? Because I told you over here that alpha 1 receptors are GQ type and GQ type are excitatory type. So therefore it helps in vasoconstriction and it increases blood BP. Alpha 2 is again of three types, alpha 2A, alpha 2B, alpha 2C. See, where is it present? Alpha 2A, alpha 2B, alpha 2C. Alpha 2A is present on presynaptic. This is present on synaptic. Alpha 2C is present on extrasynaptic. And all these receptors are GI type, so therefore they cause inhibition. So example will be, if this is a nerve ending, over here I have alpha 2A, that is presynaptic receptor, right? This is the new nerve. This is presynaptic. There we have alpha 2A that is present. So what it does is, alpha 2A, here you have the new one. What it does is, this here you have the neurotransmitter coming over here, right? So this receptor will inhibit the release of these neurotransmitter. That is what this will do. It will inhibit the release of neurotransmitter from the presynaptic region. So this you need to know. Moving on, we have beta receptors. In beta receptors you have GS type. They are also GS type, that is they are excitatory. How do they act? They act by stimulating adenylyl cyclase, and there is increase in CAMP. This is how the excitatory function occurs in beta receptors. You have three types. You have beta 1, you have beta 2 and you have beta 3. Now where are they present? Beta 1 is present on heart and it is also present on kidney. What does it do? On heart, it will act on the SA node. It will cause an increase in heart rate. Why? Because I told you that it is excitatory type of receptor because of presence of it is because of presence of GS type of GPCR. It will act on the SA node. It will act on increase heart rate. It will act on AV node. Therefore, it will increase the conduction, and it will overall lead to increase in force of contraction. Now it is present on kidney. Who is present on kidney? Beta 1. Beta 1 is present on two places. One is heart and the other one is kidney. On kidney, what it does, it will stimulate your JG cells to release renin, and therefore there will be increase in blood pressure. This is what it does, its action on kidney. Beta 2 receptors are present on it is present on four places. That is, first it is present in liver, pancreas, skeletal muscle and smooth muscle. Present in liver, pancreas, skeletal muscle, smooth muscle. What does it do? In liver, it will stimulate glycogen breakdown. So therefore there is hyperglycemia, right? In the blood, there will be increased level of blood glucose, therefore it will be hyperglycemia. In pancreas, it will stimulate insulin release, which will cause hypoglycemia. And in skeletal muscle, it will lead to contraction of the skeletal muscle, which will eventually lead to tremors. And then it is present on smooth muscle, and in smooth muscle, it does not lead to contraction of smooth muscle. Instead, it leads to relaxation of the smooth muscle. Example will be like we can see bronchodilation happening, and in blood vessels you will see vasodilation happening. In uterus you will see relaxation happening. So this is very important. This function is like very important. Everything is very important. And then you have beta 3 receptors. Beta 3 receptor is present on bladder, and it is also present in adipose tissue. It is present on bladder, which helps in relaxation. It's present on adipose tissue, it helps in lipolysis. So one thing that you need to know about blood vessel is that on blood vessel you have both alpha 1 and you have beta 2 receptors present. So alpha 1, it leads to contraction of blood vessel. Recall that we read alpha 1b. From B we had blood vessel, and which leads to contraction, right? So alpha 1 lead to contraction and beta 2 leads to dilation. Why? Because beta 2 receptors is present where? It is present on smooth muscles. It is present on smooth muscle. Smooth muscle helps in relaxation. So therefore it will lead to vasodilation. How can you remember this? You can simply remember it like this: A, B, C, D. Alpha helps in contraction, beta helps in dilation. So this is the question that we are going to be solving today. That is, write a short essay, or it can be like a 5-mark question on alpha blockers या फिर prazosin. Mechanism of action, write its mechanism of action, uses and adverse effects. I have also written classification, so that if in any question classification comes, you know about the classification also, and it is important to know about it. So first we are going to be talking the alpha blockers, right? We have two types, non-equilibrium type and equilibrium type. Where have you come across this equilibrium term? You have come across it in your 11th standard, right? 11th standard or first PUC, you have learned equilibrium chapter. So from there you have non-equilibrium type. Then another chapter that you had learned in chemistry in 12th was haloalkane. Like, I'm just saying so that you remember the classification. You have in non-equilibrium type, remember haloalkane. This you read in 11th, this you read in 12th, haloalkane chapter in organic chemistry, haloalkane amine, and then add one beta to it, beta haloalkane amine. So here there is amine, so here also there should be amine. You have phenoxybenzamine. The drug that comes under this class is phenoxybenzamine, right? See, alpha blockers, you have two types, that is non-equilibrium type and you have equilibrium type. In equilibrium type, I told you to remember haloalkane amine, add one beta to it, beta haloalkane amine. Here also there should be amine, phenoxybenzamine. Okay. Then in equilibrium type, you have three types. This is easy. In equilibrium type, you have three types. One is alpha selective, one is alpha 2 selective. So one is alpha 1 selective, one is alpha 2 selective. The next one is non-selective. That means that the drugs that come under this, they specifically act on alpha 1 receptors. The drugs that come under this, they specifically act on alpha 2 receptors. Non-selective in the sense, they act on both of them. Like, they're not selective to anyone, they act on both of them. So in equilibrium type, you have non-selective, you have alpha 1 selective, and you have alpha 2 selective. In alpha 2 selective, you have the drug that is yohimbine. This is easiest to remember, only one drug is there. So write off this first, you have yohimbine over here. And in alpha 1 selective, you have prazosin, terazosin, doxazocin, alfuzosin, and you have tamsulosin. So all these drugs end with the word zosin, right? So you have prazosin, terazosin, doxazocin, alfuzosin. This I wrote because there's one Bollywood song. Okay, even I don't know properly. Something like Arafu Allah. So lol, yeah. So from that song you can just remember known as alfuzosin. You have tamsulosin. It's, even if you write three drugs, it's more than enough. So in non-selective, you have ergot alkaloids. And then you have hydrogenated ergot alkaloids. Then remember miscellaneous is there, and then you have something known as imidazoline. This you need to remember, and I feel like this only everyone will forget. This imidazoline. So in ergot alkaloids, you have ergotamine and you have ergotoxine. And then you have hydrogenated ergot alkaloids. This only we will hydrogenate it. It will become dihydroergotamine, and this will become dihydroergotoxine. In imidazole, you have phentolamine And in miscellaneous, you have chlorpromazine. This is a very important drug that you will be reading further in CNS chapter also under the heading of antipsychotic drugs. So this drug is very important. You need to remember it. That's chlorpromazine. Okay. So coming to the mechanism of action. Mechanism of action is that alpha blockers, what do? They block alpha receptors. Now where are these present? It is present alpha 1a and alpha 1b. We know that in iris it causes mydriasis, right? Normal function. But alpha blockers, they will block this action. They will not let mydriasis happen. Active mydriasis take place. There can be paralysis of that action, or it can lead to or it can cause meiosis also. But usually mydriasis will not take place. It is present on IUS, right? It is present on internal urethral sphincter. Its normal function was contraction, but now contraction will not take place because we have added alpha blockers. Instead, what will happen? Relaxation will take place. There will be urination occurring. See, if this is your IUS. If internal urethral sphincter contracts, what will happen? This will get blocked. Like imagine like this will like get blocked. Therefore, there will be urinary retention. Now, if it relaxes, it just moves up far away. So therefore, there will be urination taking place. And in alpha 1b, you have blood vessel. In blood vessel, usually we learned that there is contraction happening, but because we have added a blocker, what will happen? Dilation will happen, and there will be decrease in BP. This is very important. Moving on to the uses. Actually, uses and adverse effects are covered simultaneously in the upcoming discussion, but I have also written adverse effects, so that separately also for you guys. I have written adverse effects separately, but it is covered in this part only. Yeah. Uses. First drug we are going to be talking about is phenoxybenzamine. Phenoxybenzamine is usually given IV, and it is the drug of choice to control hypertension and BP in pheochromocytoma. What is pheochromocytoma? Tumor in adrenal gland is known as pheochromocytoma. If there is a tumor in adrenal gland, what adrenal gland releases what? It releases catecholamines, right? There will be excessive release of these. So therefore, there will be increase in BP. Therefore, to decrease BP, we give alpha blockers. Which alpha blocker we give? This is the drug of choice, phenoxybenzamine. So, to control hypertension and BP in pheochromocytoma. But because this will lead to what? This will lead to vasodilation, because of which there is decrease in BP. But what is the side effect is that it can lead to reflex tachycardia. What will happen is that in our body, the blood vessels will start dilating, right? Because of which the brain, like your brain, will think that, oh my god, everything is like dilating. Brain's function is to like make everything work together. So it will think that there is excessive dilation happening. So brain will tell the heart to pump more blood, to increase the heart rate. So therefore you have reflex tachycardia. Reflex in the sense it is happening because there is decrease in BP. It will lead to reflex tachycardia. So this is the side effect. We do not want this, because in pheochromocytoma already heart rate is increased, and again if there is reflex tachycardia, it is not good for us. So what do? Is we add propranolol. What is propranolol? It is a beta blocker. I told you beta receptors are present on beta 1 is present on heart, right? So it will block this. Beta blockers will block the action on heart. So therefore there is no reflex tachycardia taking place if we give propranolol. Okay, next it controls the symptoms in pheochromocytoma. Moving on, we have phentolamine. Phentolamine, which class of drug did it come under? It came under imidazoline. Recall. Okay, whenever you're studying also, you need to recall like this. Whatever you have read, just don't keep reading in one flow. Go back, recall like this word where else you had seen, and recall it. That time you will remember more. So yeah, phentolamine, it is rapidly acting and it is a short acting drug. It blocks both alpha 1 and alpha 2 equally. Therefore, it comes under non-selective alpha blocker. Like go behind and check if you want. I don't want to scroll that much again. So in uses of that is, it is used as a quick short acting alpha blocker for diagnosis and intraoperative management of pheochromocytoma. This is also used in pheochromocytoma, but it is used for other purpose. It is used for diagnosis, and it is used for intraoperative management of pheochromocytoma. It is also used in cheese reaction. Cheese reaction is nothing but a hypertensive crisis. and it is also used if there is sudden clonidine withdrawal. And phentolamine is also used in the treatment of erectile dysfunction. It is given as a cavernosal injection. It is given as a cavernosal injection. You can take a note of it, and it helps in the treatment of erectile dysfunction. Next drug we have is chlorpromazine. Chlorpromazine, I told you that time also that chlorpromazine comes under which category of drugs? It comes under miscellaneous. And I told you that time that we will further learn it in CNS chapter. So therefore it is an antipsychotic drug plus it is an alpha blocker. Next we have ergotamine. Ergotamine, it is a serotonin agonist plus alpha blocker. Serotonin agonist, what does it do? It will increase serotonin agonist. It will lead to vasoconstriction in small end arteries. Therefore the side effect of this ergotamine will be there will be dry gangrene of fingers. This is known as this phenomena is known as ergotism. The next drug that we have is prazosin. Prazosin, it is a drug of choice in benign prostate hypertrophy with hypertension. If there is a person, he has BPH, that is benign prostate hypertrophy. Along with that, if he has hypertension, we give prazosin drug. It is also used to control hypertension and pulmonary edema in case of scorpion sting. Okay. Next, it is also good for diabetes mellitus and dyslipidemia. Terazosin and doxazosin, they also help to reduce the prostate size. So it is good for BPH. Now coming to the side effects of prazosin, this is very important actually. Side effect of prazosin is that it will lead to postural hypertension due to first dose effect. That is, this postural hypertension is seen only in the initial few days. After some days, tolerance will occur. That is when you take prazosin, and if you suddenly get up, you can't walk properly, there will be postural hypertension taking place. So how do you treat that postural hypertension? What do? We just give the prazosin at bedtime, so that if you take prazosin and you're just sleeping, right, for straight 6 to 8 hours, you're just sleeping, so you won't get up and walk, so therefore there won't be any postural hypertension taking place. Therefore we give it at bedtime, or we started with a low dose. Okay, so this is how we treat it. Next side effect of prazosin is that there will be failure of ejaculation and there will be floppy iris syndrome, that is no mydriasis taking place. You can remember this because it is an alpha blocker and alpha 1a is present on iris. I told you, right? And it causes mydriasis. Now here, because it is a blocker, there is no mydriasis. We call this condition as floppy iris syndrome. Other uses will be it is given in the treatment of secondary shock due to fluid loss and blood loss, which will lead to reflex vasoconstriction. So due to fluid loss and blood loss, what will happen? It will lead to reflex vasoconstriction, and we do not want vasoconstriction. Therefore we give off alpha blockers, which will lead to vasodilation. See, if volume replacement failed to reverse this, there can be pale and cold extremities, pulse pressure does not improve, and pulse pressure also does not improve. Then alpha blocker like phenoxybenzamine will help. We give alpha blocker such as phenoxybenzamine in secondary shock to cause vasodilation, to remove this reflex vasoconstriction. Because of this reflex vasoconstriction, what is happening? Pale and cold extremities and pulse pressure also is not improving. To overcome all of this, what we are giving? We are giving an alpha blocker alpha blocker known as phenoxybenzamine. It is also given in chronic heart failure. That is, in chronic heart failure, why it is given? Because it will cause vasodilation, and it is only used in short term and it is not given in long term. It is also given in peripheral vascular diseases because again it causes vasodilation. Peripheral vascular disease, what will happen? There will be vasoconstriction happening, so we will give we will give alpha blockers which cause vasodilation. And then it is given in papaverine or phentolamine induced penile erection therapy for impotency. I told you, right? Phentolamine we read. Recall that in the third function or something I had written that it is given for treatment of erectile dysfunction. It is given as a cavernosal injection. That point is only has been, I have written it again. Papaverine or phentolamine induced penile erection therapy for impotence. As I told you, the adverse effects has been covered in the discussion that we did right now, but I have just written it at one side. So the adverse effects of alpha blockers is that it may cause very low BP, which may lead to hypotension in some people. It causes first dose effect. It causes sexual dysfunction and some general adverse effects such as headache, nausea, weakness, and tiredness. So thank you for watching. Keep learning and keep smiling. I will see you in the next video.